अस्सलाम वालेकुम, वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में एसके सीरीज़ के सर्जरी 23 फरवरी मॉर्निंग का पेपर में डिस्कस करने जा रहा हूं। तो चलें स्टार्ट करते हैं। क्वेश्चन नंबर 1, प्रोटीन डज नॉट पास बेसमेंट मेम्ब्रेन ड्यू टू अल्फा नेगेटिव चार्ज। सेकंड, द मेजिटर इंजर्शन इज ऑन द एंगल ऑफ द मैंडिबल। क्वेश्चन नंबर 3, the patient moving from supine position to the standing position, compensation by which of these, that is increase in the heart rate. For the slowest conduction speed in the cardiac conduction system is a feature of which of the following structure, that is beta AV node. 5, the slowest conduction speed in the cardiac conduction is seen in the beta atrioventricular node. Next, question number 6, a man with the chest pain from the last 3 hours, which enzyme will be raised, that is alpha CKMB. 7, a patient presented with the signs of hypovolemic shock and received treatment for this very cause. Which indicator should be assessed for the initial recovery in him, that is Charlie, increase in the urine output. Question number 8, the pregnant female with the labor pain for the 20-hour was admitted in the emergency and was being prepared for the C-section, suddenly dies due to Charlie amniotic fluid embolism. 9, the deficiency of the niacin causes Charlie plegra. 10, niacin deficiency causes which of the following effect, that is beta CNS defects. Question number 11, emboli in the venous circulation will lodge in the beta pulmonary artery. 12, the fat digestion is done by alpha emulsification, bile salt and the lipase. 13, total body weight is calculated by beta antipyrine. Next, question number 14, a patient whose perineal surgery is going on, the patient is in the Trendelenburg position, what will increase, that is E, lung compliance. 15, a boy had a car accident after which he is bedridden, he develops DVT, he came to ER with the chest pain and dyspnea, what will be the findings, that is beta increase in the VQ ratio. 16, the peripheral chemoreceptors are stimulated by the Charlie decrease oxygen. 17, a patient's ABG revealed pH of 7.54, partial pressure of carbon dioxide 40 and the bicarbonate 38. What is the acid base disorder, that is E, uncompensated metabolic alkalosis. Next example of the positive feedback mechanism is alpha childbirth. Question number 19, Dubai businessman daily go to the office in the morning and sleep early at night. Melatonin and ACTH are involved in the circadian rhythms. Which part is responsible for regulating circadian rhythms and sleep-wake cycle, that is Charlie, that is suprachiasmatic nucleus. 20, at the end of a marathon race, a person has Charlie, high glucagon and the low insulin. 21, a 6-year-old girl presented to the OPD with excessive facial and the chest hair, adult size external genitalia and deepening of voice. She also gives history of 2 siblings death suffering from the same condition. Which enzyme deficiency leads to this, and best test for the thyroid disorder is, that is Charlie thyroid profile. 22, a female has the vaginal infection and organism isolated with the jerky movement is Trichomonas vaginalis. Charlie. 23, a patient presented with the pneumonia treated with a beta lactamase remains hospitalized for the 3 days. Symptom resolved but after discharge came to OPD with the diarrhea. Treatment should be for the diarrhea, that is alpha metronidazole. 24, the thrombocytopenia is the side effect of the quinine alpha. 25, the therapeutic dose of the drug indicates alpha potency. 26, the primordial germ cells are formed at the beta the end of 3rd week. 27, patient presented with the UTI culture shows gram-negative organism with the swarming motility. What is the responsible organism, that is the Proteus. 28, a most common complication of the rubella in the 3rd week pregnant lady is alpha cataract. 29, young group of boys living the daycare service, all of them are having malaise and the weakness and the restlessness during night. They can't sleep properly due to the perineal itching. What is the cause of their symptoms, that is gonna be Enterobius vermicularis. 30, which of the following organism is responsible for the rheumatic fever, that is group A beta hemolytic streptococcus, group A streptococcus pyogenes. 31, intention tremors and the jerky eye movements occur due to beta, that is cerebellar lesions. 32, the patient cannot perform rapid movements after the lesion of the cerebellum, it is called as alpha dysdiadocognesia. 33, the cysticercosis caused by which of the following, that is beta injection of ova of Tinea solium. 34. Which of the following occurs due to the sympathetic stimulation, delta bronchodilation? 35. Ambulance transport system in hospital is the sport system. 36. Renin secretion is inhibited by the beta blocker. 37. Neurophysiologist while stimulating a nerve is unable to generate action potential. It is due to the hypokalemia. Next, 38. The sympathetic cholinergic discharge occurs in the sweat glands. 39. Neurotransmitter in slow type C fiber is the substance P. 40. Most abundant cells in the gray matter of the CNS are protoplasmic astrocytes. 41. The neck of the female urethra lies above the urogenital diaphragm. 42. What is the nerve supply of internal urethral sphincter? That is splanchnic nerve. 43. A section of the caudal pons consists of horizontal fibers. These fibers most likely consist of the middle cerebral peduncle. 44. A nail injury to the submental triangle, the muscle that would be pierced would be the genoglossus. 45. Lesser omentum contains Charlie hepatic artery proper, CBD in the portal vein. 46. Structure not in the spermatic cord but present in the inguinal canal is ilioinguinal nerve. 47. Liver drive from which of these, that is the foregut? 48. Musculophrenic artery is the branch of the internal thoracic aorta. 49. Right main bronchus is divided into how many lobes? That is 3. Charlie. Next, 50. Regarding bronchus, true is beta, that is the left bronchus is larger than the right one. 51. Which of the following has the intra-articular tendon popliteus? Which of the following muscle cause hip and knee flexion? That is sartorius. Next, 53. Patient came with the history of the fall from the height, talus fracture. This will lead to the damage of the medial longitudinal arch. 54. On upper part of piriformis, which one will pass? That is superior gluteal artery. Next, 55. The medial rotation of arm is caused by the teres major. 56. A sudden separation that involves the lateral end of the clavicle sliding onto the superior aspect of acromion would likely result from the damage to, that is the coracoclavicular ligament. 57. Patient has loss of supination. Which of the following nerve injury is responsible for this? That is radial and the musculocutaneous nerve. 58. For long-term control of diabetic mellitus, test done is HbA1c. 59. Regarding cartilage, true is appositional growth. 60. Medial attachment of the flexor retinaculum is the pisiform bone. 61. In median nerve injury there is lateral 3.5 finger sensation lost. 62. A person who is unable to button and hold pen due to the damage of which muscle? That is oponaspolysis. 63. The transient adhesion are due to the slactins. 64. After finger cut, what is the first response of body after bleeding? That is definitely blood vessel constriction. 65. 64 years old female with the fatigue, bruisability, easy bruisability after small cuts and recurrent infections alongside. After investigations, the report shows 90% blast cells and or bodies in the smear. What is the likely diagnosis? That is Charlie AML M3. 6. Patient with the HB5 enlarged spleen in the recurrent blood transfusions. What is the diagnosis? Thalassemia major. 67. Hodgkin's lymphoma with the mixed cell artery association with which virus? Epstein-Barr virus. 68. 30-year-old female present with MCV less than 70 and the low serum ferritin. Likely diagnosis: iron deficiency anemia. 69. The pregnant lady in the first trimester having HB of 10, on third trimester having HB of 9. Most likely it is physiological change. 70. Hubble jelly body are seen in the hyposplenism. Next, 71. The person with the hypertension and the bradycardia, which one of the following is present along with it? That is a raised ICP. Diabetic patient presenting the OPT with the oozing greenish discharge from the wound. Which of the following is the causative agent? That is Pseudomonas. 73. Child with while supine with the peanut aspiration, it will lodge in the apical segment of the right lower lobe. 74. The gun complex are the characteristic of the primary TB. 75. After bone marrow transplant, there are lung infiltrates on histology and the cytology of the fluid from the tracheobronchial lavage cells. Organism involved will be the cytomegalovirus. 76. A old man collapsed and his ECG shows arterial rate of 75 and the ventricular rate of 35. What is the cause? That is the Adams-Stokes. 77. Which one causes the steatorias? That is the pancreatic resection. 78. Gastric lymphoma related to which of the following? The H. pylori's. 79. A patient has the fever, sore throat and having pharyngitis. Examination: whitish membrane seen on the throat. This is related to the Corneobacterium diphtheria. Next, fluent nonsense speech is due to the damage of which of the following? The vernix area. 81. Least mineral found in the tubers. Next, 82. The Cryptococcus neoformans can be visualized by the Indian ink strain. 83, the injection given 2 centimeter below and lateral to the pubic tubercle damage nerve will be the obturator. The child with the multiple fractures, the sclera, blue sclera, his uncle had the similar complication in the past, but the diagnosis that is osteogenesis imperfecta. 85, the superior thyroid artery is the branch of which of the following, that is external carotid artery. 86, IVC form at the level of which vertebral body, that is the L5. The patient after 1 year of the gastrectomy has the anemia, fatigue and the raised MCV, which is 110. He is also having the peripheral numbness and tingling sensation, which are the following anemia he is suffering from, and that is definitely pernicious anemia or otherwise vitamin B12 deficiency. 88, a 20-year-old boy presented with the scrotal swelling after injury. Contents of the swelling extend up to abdomen and not reaching thighs. Most common cause of his swelling is the injury to the penile urethra. Next, 89, the stab wound on the right side below and lateral to the umbilicus will cause injury to the IVC. 90, a 16-year-old girl with the epistaxis, menorrhagia, PT, APT, BT, all are prolonged, that is a DIC. First step in the thyroid hormone synthesis is delta, that is the oxidation of free iodine. 92, with regard to counseling, the best statement is it is a technique to help people help themselves. 93, the diuretic of choice in the pulmonary edema, that is the loop diuretic. Macrophages in the CNS, microglial cells. 95, anterior dislocation of femur on the tibia ligament damage is the posterior cruciate ligaments. Anterior dislocation of femur on tibia ligament damage is the posterior cruciate ligament. Next, 97, the tumor with nerve sheath involvement is the carcinoma ex pleomorphic adenoma. 98, the neurotransmitter given in the cardiogenic shock is the dopamine. 99, the M-bands produced by the plasma cells. 100, O negative blood transfused with the AB positive. What is the secondary blood transfusion reaction? That is going to be hemoglobinuria. Next, 101, abundant cilia is present in the maxillary sinus. 102, major blessed lymph nodes parallel to alpha along axillary vessels to the pectoral nodes. 103, the treatment of erythroblastosis fatalis of the beta positive exchange transfusion done with which of the following, that is the beta negative. Patient has the neck swelling which moves during swelling, which initial investigation should be done, that is the ultrasound. 105, the female with the short stature, hand and swollen in the neck and is now 20 years of age with amenorrhea and the absent secondary sexual characteristics. Likely karyotype of this diagnosis is Turner syndrome. 106, genetic analysis done with alpha, that is amniotic fluid analysis. 107, woman had a polyp in the cervix. Pap smear shows thick endothelium with pleomorphic cells and the hypochromatic nuclei showing coilocytes. The change is dysplasia. 108, squamous cell carcinoma diagnosed in the persons who came from Dubai and presented the painless hematuria. Likely organism associated with the disease is schistosoma hematobium. 109, staging of the tumor shows extent of the tumor. 110, which of the following tumor follows the Knudsen 2 hit hypothesis, that is the retinoblastoma. 111, the immunity against the COVID-19 and the tumor cells is of the NK cells. 112, a young girl with the blisters on the extremities. Type of the flood present between the dermis and the epidermis is the serous flood. 113, the patient is on the radiotherapy. After that, the DNA damage, a gene which arrests in the G1 phase progression, defective unregulated growth occurs, due to which, that is the P53. 114, the carcinoma that is spread through the vertebral arteries has which marker, that is a PSA. 115, the security guard got gunshot injury on the lower back after physiotherapy and the rehabilitation. He had lost contralateral pain, temperature below the level of the Lee and ipsilateral, loss of vibration. What is the diagnosis? That is Brown-Séquard syndrome. 116, 116, the which inhalation anesthesia caused the greater decrease in the vascular resistance, that is the halothane. Next, 118, the woman presented with the valvular itching and the pinkish purulent discharge. What is the cause? That is the trichomonas vaginalis. 119, the female present with the pain in the first tarsophalangeal joint due to the gouty arthritis. 120, the microtubules are present in the centrioles. 121, best host defense in the alveoli is the alveolomacrophages. 122, the regarding fetal hemoglobin true is more oxygen binding capacity. 123, norepinephrine senses require which enzyme? That is beta dopamine hydroxylase. Next, 1 to 4, the ADH act mainly on the distal tubules. 1 to 5, right ventricular characteristic feature is pulmonary trunk arises. 1 to 6, a person loses 2 liter of the sweat while working and drinks 2 liter pure water. What changes will occur? That is delta increase ICF volume. 1 to 7, on light microscope skeletal muscle under low magnifying characteristic feature is the light and dark bands. 1 to 8, qualitative change in the gene expression is alpha, that is the point mutation. Next, 1 to 9, buffer found in the kidney but not in the plasma is the ammonia. 130, a person went to Thailand and presented the diarrhea which is watery and the large in amount. In stool sample, donut shaped crystals are found, that is cryptosporidium. Next, 131, the ionizing radiation caused damage to the cells by which of the following, that is the free radicals. The 132, the patient diagnosed case of the carcinoma and treated with the radiation treatment of carcinoma of the radiation decrease its size by ionizing free radicals. 133, which of the following parts of the body has the cortical neurons with the largest representation on the primary motor cortex area? Number 4, that is the finger. 134, 5-year-old child, episodes of epistaxis, gum bleed, platelet count normal, BT20 and the APTT 28 seconds, that is basically 1 virulent disease. 135, the patient having sore throat and the pus is coming from ear, which organism is most likely related to it? That is the step pneumonia. 136, the sterilization of endoscopic instruments is by the glutaraldehyde. Instruments are more, so it is 2%. If it would have been floored, that must be 1%. Okay. 137, ligament made by thickening of the parotid fascia, that is beta stylomandibular ligament. 138, only sensory afferent nerve that carries information to the brain is the optic. 139, the brainstem parts include that is the pons, medulla and the midbrain. 140, the chronic cold adaptation occurs through which of the following mechanism? That is the formation of the brown fat. 141, age estimation from 5th to 12th week is done through the crown rump length. 142, hemiballismus occurs due to the damage of subthalamic nuclei. 143, falling produced by the plasma cell, that is the gamma globulin. 144, the regarding preferential thoroughfare channel, correct statement is, that is the right option is missing here. I think it must be D, present at the origin of the precapillary sphincter. Next, 145, enzyme in the saliva that prevents the iron utilization by the bacteria is the lactoferrin. 146, the randomization is generating random sequence and selecting random population. 147, squamopulmonary epithelium present 3 cm above the cardiac end of esophagus, diagnosis is Barrett's esophagus. 148, structure the medial side of the lesser omentum is the hepatogastric ligament. 149, 19-year-old presents patient's bone marrow is classified by the FAB system as an L3 leukemia. Which of the following best describes this leukemia? That is ALL. 150, the lung compared to the systemic circulation has beta decrease resistance. 151, the patient is having ataxia. Which part of cerebellum is affected? The vermis. 152, rat bite cause fever by the toxin, that is Streptobacillus monaliformis. 153, disoriented old patient was brought in the emergency by the wife. Compliance of right flank pain, vomiting. Diagnosis of the acute appendicitis was made and urgent appendectomy was suggested. Patient didn't give consent for the surgery. Next step would be take consent from the wife. 154, beta cell markers used for their identification in a tumor is Charlie CD19. Next, 155, renal part which run from the renal cortex to medulla between the renal column is renal pyramid. 156, person got axillary injury. Which muscle will be sparred in CA to T1 injury? That is pronator quadratus. 157, intestinal motility is affected by the VIP, vasoactive intestinal peptide. 158, arteries running at the back or the floor of stomach is likely to cause bleeding. This in abdomen, that is the splenic artery. 159, the person sitting in a room, athlete and other man, what former will have increase in the cardiac output? 160, the girl doing exercise heavily to maintain fitness, there will be decrease in the skeletal muscle vascular resistance. 161, the patient came in the comatose condition. CSF analysis shows the glucose 20, protein 150, 75% neutrophils and 24% lymphocytes. Diagnosis is the partially treated bacterial meningitis. 162, jaw reflex mediated by the cranial. Number 5. 163, the preoperative male having 21 HB, 65 hematocrit, what should be done? That is the venesection. 164, patient is suffering from dysphagia, dysarthria, analgesia and the thermoanesthesia. On ipsilateral side of the face and ipsilateral Horner syndrome occurring of the following artery will produce these signs and the symptoms? That is the posterior inferior cerebral artery pica. 165 frontal cortex lesion will more affect on the Golgi tendon organ. 166 parasympathetic decreases heart rate by the effect on the sodium and the potassium. 167 meiosis of the nose caused by the lava fly. 168 migratory motor complex is triggered by motilin. 169 chromosomal manuring does not occur in asexual reproduction. Delayed cell mediated hypersensitivity is falling, that is beta. The contact dermatitis. 171 after giving blood transfusion patient develop hypersensitivity reaction. Which type of reaction is this? That is the type 2 hypersensitivity. 172 regarding a typical spinal nerve that is formed in intervertebral foramen. Last 173 patient after artery fracture of 9 and 10 ribs left side hypotension causes which of the following? That is beta splenic rupture. So thank you for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.